Professor Dave again. Let's learn about syphilis.
He knows a lot about the science stuff. Professor Dave explains.
Syphilis has been around for a long time. Though there's some debate regarding where and when it first appeared, historians can at least agree that the first well-documented outbreak of syphilis occurred in Italy in 1495. Back then, we didn't have antibiotics or any effective treatment for that matter. Before penicillin was discovered, the painful symptoms of syphilis, including genital sores, abscesses and ulcers all over the body, and severe pains, were treated with mercury or other mostly ineffective home remedies. This meant that on top of the painful symptoms, many patients died of mercury poisoning. Let's learn a bit more about this disease and its modern treatment now. First, let's talk about what syphilis actually is. It is a bacterial infection caused by Treponema pallidum that's spread most commonly through sexual contact, but it can also be passed from a pregnant woman to her baby. These bacteria are thin, tightly coiled spirochetes, which are gram-negative, motile, spiral bacteria. They have pointed, straight ends with flagella on each end, which allow them to move around. These organisms are difficult to grow in the lab and too thin to observe with a light microscope. So scientists have analyzed their genome to figure out what types of proteins or virulence factors they may use to cause damage. While scientists have identified a few proteins that are associated with virulence, precisely how these proteins are involved remains to be determined. Ultimately, the tissue destruction and lesions observed in syphilis cases are caused by a patient's immune response to infection. The disease follows a progression of stages that can last for weeks, months, or even years. The initial or primary phase is characterized by one or more skin lesions called cankers, which mark where the bacteria entered the body. These cankers are painless and might occur in locations you don't regularly examine and hence might not notice, and then heal within 3 to 6 weeks, even without treatment. However, without adequate treatment, the infection will progress to the secondary stage. In the secondary phase, the bacteria have spread through the blood, causing prominent skin lesions or rashes over the entire surface of the body. In some cases, these rashes are so faint they're not noticeable, but in others, large, raised gray or white lesions may form. In some patients, the infection may cause a sore throat, swollen lymph glands, fever, weight loss, or fatigue. If the disease isn't treated in the secondary stage, it will progress to the latent phase of the disease, in which there are no visible symptoms at all, which can last for years. In rare cases, tertiary syphilis can develop 10 to 30 years after the initial infection, affecting multiple organ systems. This can be fatal. At any of the above stages, syphilis can infect the nervous system or eyes, causing a wide range of potentially serious symptoms. In infected pregnant women, untreated syphilis can cause infant death in up to 40% of cases. For the babies that survive, they're at risk of seizures, developmental delays, or death if they aren't treated. Despite its long history, syphilis is quite common. The World Health Organization estimates that there were 18 million syphilis cases worldwide in 2012, with 5.6 million new cases occurring in adults between the ages of 15 and 49. In the U.S. alone, CDC estimates there were over 115,000 new cases of syphilis in 2018. Syphilis is typically diagnosed using blood tests and treated with penicillin or other antibiotics. Any sexually active person can get syphilis through unprotected sex, so healthcare providers recommend using condoms and getting regularly tested for STDs. However, since the bacteria are extremely labile and unable to survive exposure to drying or disinfectants, syphilis cannot be spread through contact with inanimate objects like toilet seats. Thanks for watching, guys. Subscribe to my channel for more tutorials. Support me on Patreon so I can keep making content. And as always, feel free to email me, ProfessorDaveExplains@gmail.com.